Otosclerosis is roughly defined as the abnormal hardening of bone tissue of the middle and inner ear, which disrupts the ability of sound to travel from the middle to inner ear. There are two types: otosclerosis that affects the stapes footplate in the middle ear, and cochlear otosclerosis. Otosclerosis is seen more in white, middle-aged women, often during pregnancy, possibly due to hormonal changes. More than 3 million Americans have otosclerosis. In recent years, it has been suggested that otosclerosis is a late-onset genetic disorder. Many cases are thought to be inherited. Otosclerosis of the stapes footplate would look like a conductive hearing loss on a pure tone audiogram. Cochlear otosclerosis would show on an audiogram as a sensory neural hearing loss. For bone conduction, a Carhart's notch, a depression around 500 to 2000 Hz, would be visible on the audiogram. Carhart's notch appears if stapes fixation is also present. When viewing the middle ear through an otoscope, the tympanic membrane appears to have pinkish coloration, also known as a Schwartz sign. In addition to typical audiological assessments, otosclerosis can also be diagnosed with medical tests such as CT scans, especially when diagnosed by an ENT. Otosclerosis is diagnosed by different healthcare professionals who specialize in hearing, such as audiologists, otolaryngologists, ENTs, and otologists. The tympanogram would be a type AS, or possibly a type A. To test for otosclerosis, we conduct a hearing test and record our results in an audiogram. Audiograms taken from patients with otosclerosis typically show a low-frequency conductive hearing loss. They may initially show a sensory neural hearing loss, but most develop into the conductive loss pattern. Otosclerosis progression can be monitored by an audiogram. As the stapes footplate becomes fixed to the oval window, the conductive loss worsens and begins to involve all frequencies. If cochlear lesions develop, as is the case in 10% of patients, high-frequency sensory loss results in a mixed sensory neural and conductive hearing loss pattern on the audiogram. Acoustic reflexes may eventually be absent, but early on may show the on-off effect. Tympanometry often shows stiffening of the acicular chain. This is an example of a sample audiogram of otosclerosis. In this, you see a bilateral conductive hearing loss consistent with bilateral otosclerosis. Notice the Carhart notch and the bone conduction scores in both ears. Possible treatment and rehabilitation includes 4 types, all dependent on specific cases. Otosclerosis doesn't have to be treated, so a patient can choose to do nothing. It is recommended that these patients have a hearing test once a year. Amplification is another option, depending on the hearing loss. A patient with otosclerosis that leads to a conductive hearing loss can choose to use hearing aids to amplify sound. Where traditional hearing aids are not used, implantable hearing aids can be used for amplification also. The third option is medical treatment, which includes a dietary supplement called sodium fluoride. So far, this is less effective and not widely approved. When doing research on sodium fluoride, it was found that patients treated with sodium fluoride have smaller otosclerotic foci on CT scanning, which suggests that the treatment is successful. This treatment can be available over the counter and has to be taken 3 times a day for 2 years. Then the dose is reduced to once a day. Finally, patients can opt for surgical treatment. This includes a stapedectomy and a stapedotomy. These are performed to treat otosclerosis that results in conductive hearing loss. A stapedectomy is the complete removal of the stapes, while a stapedotomy is creating a small hole in the stapes. This avoids the use of hearing aids and can also correct tinnitus. This correction procedure may fix air bone gaps but does not correct any sensory neural hearing loss. This procedure is very intricate and difficult, but when done correctly, the results are successful. If the surgery fails the first time, a second surgery can be done, but the success rates are lower. Patients who have cochlear otosclerosis, which leads to sensory neural hearing loss, can opt for cochlear implantation or bone conduction implantation. Cochlear implants work best for those with good preoperative hearing levels. The implant can be difficult to position due to the shape of the inner ear. Patients may experience facial nerve stimulation after the implantation, but this can be corrected with another surgery. Bone conduction implants require a functioning cochlea and convert acoustic signals to vibrations and then stimulate the inner ear. This device has a part that is implanted and a part that is worn externally. These are our references for our project.